Welcome to this quick summary of writing demographic trends and changes. So that's P6, M4 and D2 of the Unit 10 for health and social care. So I'm just going to talk through a little bit about the materials, how they fit in with this course, so I can see how to write it. So the first thing to think about is the marking grid and also the assessment criteria that the exam board put forward. So we'll look at here on the graph, you've got P6, M4 and D2 highlight. These are the main marking criteria. So for P6, it says examine how demographic data is used in a service provision and in local healthcare setting. So this is obviously, we're bringing the healthcare setting back for P6, which it's been forgotten about for P5 and a bit of P7. We're coming back to it P6. So the main thing for the pass criteria is to look at what is happening. That's the main thing I kind of emphasize with my groups. What is happening in your local area? M4 is to analyze the impact of use of demographic data in a local healthcare setting and social care services, enabling provision of support for different groups. So effectively, what is happening is the pass. The merit is what is being done, what can be done or should be done in your chosen setting. And again, if you need to, you can expand on your setting, I would say, for P6. So if you're looking at a local GP, you could also expand to include local hospitals. And distinction is the second half here. How is the data being used to reduce inequalities? So that's the main thing. What is being done with the information? Is it helping to make a change? What are the strengths and weaknesses of the action being taken? And again, is it going to reduce inequality in your area? Main things here, just as a quick recap of that, is what is happening. So what are the issues? What does that show? What are the issues in your area? And are there any key focus areas for your local setting? What is being done, which is the merit, so the healthcare services, what is being provided? Does this contain high or low levels of different health issues? What are the local initiatives? And the evaluation, extending what could be done, I think it's also worth thinking about. What services are not being provided? What issues are not being addressed? What problems are there in your area? And obviously this comes back to your social groups as well. Who is being affected? Now, obviously, as I said before, my local areas is Essex and Colchester. Sorry, Colchester and Essex. And again, you're looking at local data. You're trying to expand and discuss the issues in your area. So in my case, a lot of this data is going to be linked to Essex because that's where we are. You can also bring in your own links. Think about stuff like COVID. How has COVID affected your area? And what is going on? So first thing is, what is demography? Now, demography is the study in changes in the size and structure of a population. This causes or includes natural changes like population shifts because of births and death rates, changes because of migration. And what we can think about, some of the areas that touch on of trends would be stuff to do with birth rates, death rate and life expectancy, family size, household size, and the impacts of migration and movements of different groups in and out of your area. So birth rate, just to kind of quickly flag it up, is the number of births per thousand of the population per year. Birth rate generally has been on the decline for most of sort of the last 50, 60 years. With that in mind, there has been a little sort of recent surge or increase in the birth rate. But again, think about, why is this happening? What impact does that have on local services? Who is going to be affected? And also what services are going to be needed or maybe not as needed in your area. And you can expand this to think about IVF and fertility services, maybe even some sexual health services. Death rate or mortality rates are the numbers of deaths per thousand of the population per year. So again, it's looking at how many people are dying in your area. And it might be worth looking at other services like diabetes clinics or availability of flu jabs, health checks of certain age groups. Are you in an area where there's a higher proportion of older people? Life expectancy is very similar to this. So again, life expectancy has been increasing nationally, globally, as society develops. And obviously some of the issues that rise, so higher rates of cancer and illnesses like this dementia in older age groups because we have a longer life expectancy. And again, some of the web links here will give you some information on that. And lastly, migration, as I said, is the movement of people in and out of country. Emigration is movement out of the country, so people leave. So I always think emigration, exit. Immigration is movement in to a country, so I for in. And again, it's think about where people go. Older people from Britain tend to retire and leave to go to Spain. Younger people are coming from Eastern Europe to work. Net migration generally is on the positive, increasing. But maybe we can recently think about stuff like Brexit and how that's affected migration. Obviously, what happens with people leaving and new people coming in. Obviously, really, really positive impacts on fertility rates and birth rates with increased migration. So before we get started, what to do? The main thing to do is do the research. Start researching your local area. Look at news reports on health, look at relevant websites. What are the issues? What's going on with population size, average age, health issues, needs, birth rate, death rate, life expectancy, poverty, mental health issues? What is happening in your area? The more data and information you can gather, the easier P6 becomes. Two big websites that we're going to use in my lessons, and also I think are useful, are the local health authority health profiles, or local authority health profiles from Public Health England, and websites like I Live Here, where you can find statistics on your local area. Now, if we look with this health profile first of all, because I really like these, I think these are really helpful. It's full of statistics, but it gives you graphs or images that look like this. They're color coded, so you can see red means that the area is significantly worse than England average. Orange is kind of, it's not that dissimilar from England, and green means it's maybe better. So looking at Colchester, these stats are for Colchester, you can see issues like violent crime quite high. We can maybe think about emissions for alcohol related issues, self-harm, alcohol-related harm, suicide rates quite bad in Colchester. Now, this could be linked back to our setting, thinking about the higher need for maybe protection from violence or support in surgeries if people become more aggressive, so maybe additional training for dealing with aggressive patients. Higher levels of self-harm might be to think about, suicide prevention, mental health awareness, support services for alcohol and drug abuse. And hip fractures is also quite bad for Colchester. But again, that could be maybe thinking about the age of the population, but also the fact that GPs will have to accommodate this higher need of elderly patients. Now, as I say, sticking with mental health as a focus, you can see these are some of the priorities of Colchester and also areas of focus. And you can see suicide reduction, mental health intervention and support are big areas and big things to look at. Now, again, in this case, we could think about what has happened recently. Some of these news articles here are all from the last 2 months in Colchester. So it could suggest there are some failings of the mental health services in Colchester, or maybe it's not working as it would necessarily need to be in order to provide support. So again, this could be something to consider and think about in your write-ups. Other areas, other things in Colchester, focusing on this health map. Colchester is very good for childhood obesity. In a sense, we have lower levels of obesity. Smoking in adults were not as bad. Recorded diabetes is pretty good. And heart attacks or cardiovascular issues and deaths of under 75s were pretty good. So these were all priorities on that previous slide for Colchester to improve. Some of the areas we're not too great at: underage conceptions, so underage pregnancies, and maybe thinking about GPs and support in terms of sexual health services in Colchester. Other things, maybe smoking at the time of pregnancy or delivery, and infant mortality rates are not as well, not as good as they should be. But other things we can think about related to this is, the fact that we have higher levels of infant mortality rate. Essex and Colchester do a baby box scheme. So just again, focusing on some of these statistics, like I say about teenage conception being slightly higher than the regional local Essex average. In Colchester, again, I couldn't find a good gif of a teenage mum, so I've gone with a teenage turtle. But you're looking at Colchester, underage conceptions. Colchester's pretty high on the scale in Essex. So obviously Basildon's the highest, where I grew up, but Colchester's pretty high on there as well. In terms of number conceptions, again, looking at the map, you can see Colchester, which has got the slightly black outline on the centre of the image, is in red, so it's quite high. But maybe think about what we can do. That one of the big things that's been done is the EC card scheme, so electronic condom card scheme. So again, trying to improve sexual health and pregnancy rates in Essex. We could also think about the infant mortality rate being slightly higher, and as I mentioned, the baby boxes being introduced to deal with that. Other demographic trends to consider, other things to look at. Look at the population growth. Colchester's population is growing. It affects all demographic groups, and obviously that will put more demand on NHS services. The average age of the population is 38.9. That's relatively young. So it means that obviously we might have to look at the services being offered. Do we need more older age services or younger age services? The proportion on benefits, the proportion who have migrated in from the outside EU. So again, it's just thinking about how this would impact on your local setting. Other things to consider. So again, think of Essex. Homelessness is quite a big issue within Colchester, within Essex. You could think about food bank use, mental health, and suicide. These would be areas to touch on. What is going on in your area? Now, other things you might want to do. Now, again, I went to my local surgery, and then again, this was pre-corona. I went to my local setting, and I took a picture of the notice board to look at some of the other services being advertised. So some of the services, obviously teenage pregnancy, young carers, that's really important for Essex because we have quite a high level of teenage pregnancy. Domestic violence abuse, obviously we said those high levels of violence, domestic violence, and extended hours. So this is more to do with the workforce, a lot of people working extended hours from the GP. We talked about mental health services. So youth services, mental health services is obviously a big thing here. We could also make that connection to marketisation with the virgin care. Essex or North East Essex Diabetes Service, the needs service. Again, Colchester, Essex has very high levels of diabetes, so the service has been introduced to try and deal with that. A really good way in which your local setting, my local setting, is responding to national data. And as I said, the notice board in my practice. Lots of posters there. Again, you probably can't see them all clearly, but there's posters of mental health services, for carers, for contraception, for drug and homelessness support, weight loss and obesity, mental health services. And again, if you can get to your setting, or you have to go to your setting for some other reason, you can also take a quick photo of the notice board and just flag up what your setting is doing, advertising, and how that relates to local areas and issues. So just the write-up for P6, how to go about it. So think about what is happening. Look at national statistics, look at local data, think about those areas we've touched on already, such as birth rates, death rates, mental health, suicide. Find the statistics, and again, use those local health fingertips, the public health England reports. They're really helpful for showing you what is going on in your area, what is good, what is bad. They can be starting points for your discussion. Once you've done all this, try and think about your organisation. What are they doing? What connection can you make between the issues in your area and the services your setting are offering? Now, if your service isn't offering any services to relate to an issue that's in your area, that could be an area to discuss, that they should be doing this. What could they be doing? M4 is the analysis. So what is your service doing to deal with those issues? How is that going to affect social groups? Who is going to be benefiting from that? Which social groups? Is it class? Is it gender? Is it ethnicity? Is it what is going on? If they don't support an issue, mention it. They should be doing this. They could be doing this. This will help this group. And again, the benefit of doing that. And then distinction, the evaluation, the data. What are the strengths and weaknesses of the data? Is it good? Is it helpful? A lot of the cases is that the data might flag up and highlight issues, but there may not be the funding to support them. So funding could be a good evaluation point. Does it give the full picture? Is it just data? Does it help us understand why these things are happening. So again, that's the distinction elements there. And as always, try and make sure you've separated your merit, distinction and pass elements, or at least you've made it clear if you combine them. But again, try and make sure you've got the information, the application, the discussion and the evaluation. And again, they're very, very short overview there, but hopefully this will give you a little bit of structure, a little bit of help when you come to write P6. Thanks for watching.